Dr. Philip Krueger. I work at St. Mary's Medical Center here in San Francisco, California. I treat patients that suffer from arthritis and degenerative conditions of the joints, and that treatment includes both surgical and non-surgical management of those symptoms and the symptoms that result from the condition of degeneration of the joints. So typically when a patient with arthritis comes in, their typical complaints are joint stiffness, joint pain, worse in the morning, worse with activity, relieved with rest. It's important that a patient like that know that once it's been established that they have arthritis, that there is really a range of treatment options. Although we don't have a cure to prevent or slow down arthritis, what we can do is treat those symptoms. And it can be effective to start a patient out with simple things like weight loss. The less weight you have on your frame, the less forces you're putting across those degenerative joints. So that can make a difference. Things like using a cane to offload some of the forces across that joint. Using anti-inflammatories, because arthritis really, arth means joint and itis means inflammation, so really it's an inflammation of the joint, so an anti-inflammatory can be pretty effective. I really believe that a patient should choose St. Mary's to have a total joint done for some very specific reasons. A lot of hospitals everywhere, a lot of hospitals in the Bay Area tout having a total joint program. And which is great. And what is a total joint program? Well, it's a group of dedicated practitioners working towards the specific needs of a joint replacement patient. What makes St. Mary's different is that they don't have a total joint program, they have a total joint center. So they have everything that the program has, but they actually have dedicated space where those patients go, and everybody in that space is dedicated towards treatment of that patient's special needs. So they don't have a nurse who's trying to deal with a different issue on the patient next door and the issues surrounding a total joint patient next to them. There are private rooms. The rooms are state-of-the-art, and everybody on that floor, the nurses, the occupational therapists, the physical therapists, everybody on that floor is dedicated towards the specific needs of a total joint patient. I choose to work at St. Mary's Medical Center because when I take a patient to surgery for joint replacement and treatment of arthritis or degenerative changes in the joint, I know that they've gotten the appropriate education before the surgery, so they know what to expect. I know that they're going to get what they need in the operating room, and I'm going to get what I need in the operating room to make sure that that surgery goes smoothly and as planned. And then post-operatively, I know that patient's going to go to a specific unit that just treats patients who've had joint replacements, and that nurse who's giving the medication knows and understands the issues surrounding a total joint patient. The physical therapist and the occupational therapist understand the specific needs, which are very different from other orthopedic patients, of a total joint patient. And that patient's going to get the specific designated care that they need to have success and the best possible outcome after a joint replacement.